Welcome back to AnatomyX. In this session, you'll be learning some of the basic vocabulary terms that you will need to understand the cases. And it's good to learn these terms before you go to the clinics, so that when you're in the clinics, you'll be able to just concentrate on the orthopedic surgeons and the patients. For each of the learning sessions, except the first one, we will have a series of objectives. Because this is active learning, and very much about you and the skills that you're acquiring and learning, the objectives will take the form of things that we think you should be able to do. So we think of teaching as equipping you with things that you need, and so the objectives are things that you'll be able to do. Not so much understand or know, but explain, move, do a particular motion, move a particular joint. The 5 objectives for this session will be to describe 3 useful basic positions for the human body, one of which you will almost never see anyone assume. The second would be to describe or explain 3 views for looking at the human body. The third would be to begin to use anatomical terms to describe locations and relationships. To begin to use the correct anatomical terms for different regions of the body, and here's where there may be some surprises. So what you think of as the arm may not actually turn out to be the arm, and what you've always thought of as the leg may turn out to be something that you didn't think was the leg. And so the ordinary language terms that and those are the 2 most glaring examples, the ordinary language terms that we often use are not usually precise enough for anatomical descriptions. And then finally, we'll describe 3 anatomical planes for seeing into deeper structures. These anatomical planes will be used mostly when we look at CT sections or radiographic images of the bodies. So when we're actually looking beneath the skin, these will be planes that we can divide the body into. So let's start with standard anatomical position, which is a position that I would be very surprised if you'd actually seen anyone in today. So right now at home, if you wouldn't mind, stand in standard anatomical position. So face forward, palms of the hands forward, feet flat on the floor. This is standard anatomical position. Have you seen anyone else standing in this position all day long? I'm betting not. This is a position that all anatomical descriptions begin from, even though no one ever stands in it. So if you're taking this course in a reclining position, lying on your back and using the computer, that position is supine. So supine is when you're lying face upwards. The opposite of supine is prone, which would mean you were lying face downwards and would be extremely difficult to do the course. So standard anatomical position, head forward, palms forward, feet flat on the floor, a position we never stand in, much less with no clothes on. And supine is lying on your back, face up. Prone is lying on your stomach, face down. So those are the 3 anatomical positions. Positions are different from aspects. So aspect, I think, is a term from architecture, and that is the view, that is how you're looking at the patient. So if we're looking at the patient from the front, that's the anterior aspect of the body. If we're looking at the patient from the back, that's the posterior surface of the body, the whole thing, not just what you're thinking of as the posterior. And then the lateral aspect is looking at the body from the side. So again, these are 3 ways of looking at the body, and at the beginning of any anatomical description, it's important to know which of those you're looking at. The next sets of terms will be terms that we use for reference, so either to locate something exactly or to locate something in relation to something else again. The first set of terms are superficial and deep. So a superficial structure is one that's closer to the surface of the body. A deep structure is something that's farther away from the surface of the body. So the most superficial structure that you can probably see right now is the skin. Bones would be deeper, and you would not be able to see them. Superior, inferior, again, assume that we're in standard anatomical position, or something like that. So the term superior means closer to the head, and the term inferior means closer to the feet. So let's take a brief quiz question. So in this diagram, we would say that true or false, the head is superior to the neck.